Welcome to the Burnaby Primary Care Network's presentation of Doc Talks, Influenza 2020. My name is Jeff Malmgren. I work to support the primary care networks, particularly around the community support side and around the COVID-19 response. Today we're going to speak fairly deeply around what influenza means in this time of COVID, both in terms of the disease itself and what it looks like in 2020, and the things that folks need to think about as we move into flu season, but also about vaccines, how to get them, where to get them, and what the risks are. And we're really lucky to have Dr. Baldev Sanghera with us to talk to you today. Dr. Sanghera is a family doctor in Burnaby at Prime Clinic. He also heads up the Urgent Primary Care Center in Burnaby for the division and the primary care network, and he is also the lead physician at the Burnaby coronavirus testing and primary care site at Central Park. He's a busy fellow, so getting him to come and talk to us was a little bit of an arm twist, and I'm glad we didn't have to twist very hard. So I really want to welcome Dr. Sanghera. He'll speak to you for a bit, then we'll have a bit of a conversation. If you do have questions that you have now, please put them in the Q&A, and we'll do everything we can to answer them. If you have questions as you go through, then again, just feel free to put them in the Q&A, and we will get to them as we go along. Also, this the session is being recorded, and it will be available on the www.burnabykoronavirus.com website sometime shortly after it's completed, and it will also be emailed out to participants, so you will have a chance to see it and share it as you go along. So without further ado, I'm going to turn it over to Dr. Sanghera. Welcome, Baldev.
Thanks, Jeff. Thanks for the intro, and welcome everybody to our session together today for talking about influenza and how we can prevent the spread in Burnaby and beyond. So just a brief overview of what actually is influenza. Influenza is a virus that can be transmitted from person to person. And viruses are one of the three types of infections that we can have. So viruses, bacteria, and fungi can cause various different types of infections. Influenza virus specifically causes mostly upper airway type of infections. So this virus can float around in the air and can be passed on by hand-to-hand contact. When people cough or sneeze, these virus particles then are shot out of your nose and mouth out into the air in front of you, and the people that you're in close contact with will unfortunately breathe it in, and it can infect their nose, their sinuses, the upper airway, and into their lungs. And so you can get a viral pneumonia secondary to influenza infection. And for people that have weaker immune systems or are simply just older, especially seniors and very young people with other underlying chronic conditions such as asthma, COPD, and possibly cancer and other conditions that cause their immune systems to be weaker, they become then much more susceptible to this kind of infection. And the consequences can be fatal in some situations, but a lot of times people end up being dehydrated and very sick for 7 to 10 days. So the symptoms that influenza can cause are fever, headache, muscle pain, runny nose, sore throat, extreme tiredness, cough, congestion, and just general weakness. And it can last, the symptoms can last anywhere from 3 to 7 days typically, but we're noticing in the last couple of years that the symptoms have been lasting longer. So they can go up to even 14 days. And in some children, you also, and adults as well, you'll see some abdominal symptoms such as nausea, vomiting, and diarrhea as well. So that, on top of having the chest congestion, cough, and everything else, it can be quite devastating to some people. I just saw in the chat that some people are having difficulty with hearing me. If that's possible, I can speak a little bit louder and certainly increase the volume that I'm speaking at. So those are the symptoms. And in this current climate that we're dealing with, especially because of COVID-19, some of you will understand that those symptoms overlap with the symptoms that are associated with the COVID infection. And so the reason that we're recommending that people get their flu shot this year is to prevent the flu causing confusion with, do I have influenza or do I have COVID? We're also getting some further confusion with the common cold virus, also causing similar type of symptoms. And even some people with respiratory allergies, they may be getting sore throats and nasal congestion and sneezing, coughing. And so you get further and further confused as to which one do I have. And if anybody is having any kind of respiratory infection type of symptoms, the advice to them is first isolate yourself and make sure that you're not going to work or going to school. You're also isolating yourself away from your family so that you're staying separate. And then call your healthcare provider, call your family physician, call your nurse practitioner. And over the phone, they will do a virtual assessment either by telephone or video conferencing, and they can then advise you as to, further clarification, which type of infection do you have and whether you need to actually get tested. And you may be directed to our Burnaby COVID testing site at Central Park, which is the entrance is located at Boundary and 46th Avenue. On the west side of Central Park. And if you're directed there, the best way to get an appointment there would be to go to burnabykoronavirus.com and book online to get access to a COVID test, just to confirm whether or not you have COVID, or if that's negative, then the likelihood that you're having either influenza or a common cold virus infection is much higher. So we need to have that clarification. And once that's been done, then the symptom management is mostly increased fluids, more rest, and managing the fever and waiting for it to go away. You also need to continue to be in contact with your family physician so that they can continue to help monitor your symptoms. And if you're getting worse, obviously talk to them to see if you need further medications, because sometimes you can get secondary bacterial infections causing pneumonia that can be quite devastating as well. Flu vaccine is being delivered both via your family physicians, nurse practitioners, as well as our community partners as well. So we are going to be running large flu shot clinics in the community, as well as through our pharmacy partners as well. So Jeff, that's the gist of the information that I want to share. And if there's any questions, I'm happy to answer those questions.
Great, and I think we have lots of questions actually, Baldev. I think that, and thank you, and that's it. Kind of gives, I think that gives folks what we're coming into. Do you know, is there, every year we talk about what's the flu going to be like this year? Or have we heard anything about what this year's strain of flu is like, and both in terms of transmittability and in terms of what the sort of the veracity of the disease?
Yeah, so we do, CDC, which is the Center for Disease Control, has been advising us as to the type of infections that we're expecting, and we are expecting two types of infection to come towards us. And I think they're coming from, it's more H1N1 and H3N2. Those are the two main strains that we're expecting. All of the various different vaccines that are out there have virus particles that are connected to those two viruses that we're expecting. And so you will get protection against them, as well as some of the vaccines have 3 different strains, so you get a little bit of extra protection. And then there are 2 vaccines, both of them are for actually children. One's a nasal spray and one's an injection that will actually be protecting you against all 4 strains.
Great. And in terms of that, I mean, I guess that, it's obviously this vaccine doesn't protect you from COVID, but does having the flu make you any more susceptible to getting the COVID-19 virus? Are the two related in that way at all?
So COVID has a much greater likelihood of causing an infection if somebody has a weaker immune system. And if somebody has another infection like a common cold or the influenza, that their immune system is going to be busy dealing with that infection. So COVID, if you're exposed to COVID at that time, you are at a greater risk of picking up that infection. So you may end up actually having 2 infections. Where
you actually could have 2 infections at the same time.
Okay, and your symptoms will then be amplified, and you end up feeling worse.
So that's another good reason to get the flu shot this year.
Absolutely, yeah. Now, back to the other question that you were asking earlier about what do we expect of this flu season? If we typically watch other jurisdictions where their winter and summer is flipped from us. So in the southern hemisphere, in Australia, they've already gone through their flu season. And this year in Australia, the flu season was actually milder. And it, in large part because of their public health message to everybody to physically distance themselves, wear a mask, and also more frequent hand washing, and not to sneeze out into the open, but sneezing to your elbow, and just being extra careful. So that being extra careful around each other has actually reduced the incidence of influenza in Australia and also in southern Southeast Asia.
And it seems to only make sense, I mean, this is the same precautions that we're trying to use to not transmit COVID are the precautions that will keep us away from the flu. Maybe in the long term, we end up developing these kind of practices that will keep the flu vaccine a little more less serious as we go along.
Yeah.
So one of the questions that was asked was around, and I think you talked a little bit about, there are different vaccines for different populations. And can you talk a little bit more about what that means? I mean, you talked about the children's vaccine, or the options for the children's vaccine. Is there a difference in the vaccine that seniors will get as opposed to sort of the healthy adult population?
So I'll go through all of the vaccines and I'll indicate how we are supposed to use them. So there's a general vaccine for everyone that anybody can get, and that's from age 6 months up to as old as you want to be, right? So for seniors included. So that one is called the flu viral. That vaccine will work to protect you against the 3 strains of influenza that are possibly out there. There are 2 extra vaccines that are more specifically geared towards seniors. And the reason to use those 2 over the regular flu viral is that they have an extra ingredient that amplifies the immune response. So one is called FluAd, and that one is meant for people over 65. And then the other one is called Fluzone, right? And the benefit of FluAd, Fluzone over flu viral is that you get a slightly higher level of protection, about 10 to 15% higher. But the difference between FluAd and Fluzone isn't that much. So if you don't get access to the Fluzone one because it's not available, getting either flu viral or FluAd will also give you reasonably good protection anyway. There's one more adult vaccine that's also available. It's called Agriflu, and that one is more geared towards patients young women that may be pregnant or planning to get pregnant, and it would be beneficial for them to get that one because this one has less preservative in it, but it still has the same protection for the different strains of influenza. And again, and I mentioned for the children, there are 2. There's a nasal spray called Flu Mist, and another one that's injectable called Flu Laval. If by chance, say if somebody goes to a family physician or to the pharmacy and they are asking for, say, the seniors vaccine, but the seniors vaccine has run out or there's a short supply, getting the other flu shot will also be very, very good to get. And if you are offered the children's vaccine, it's actually quite good because you're getting 4 strains in that one rather than 3.
So, and is there any danger? I mean, or you talked about, for people, pregnant women or women who are thinking of becoming pregnant, and the non-use of preservatives. Are there any risk factors around any of these vaccines that people should be aware of before they get them?
So as far as young women that may be wanting to get pregnant or are pregnant, most of the studies that are done to verify and certify the safety of certain vaccines, the studies are all done on people that are not pregnant. So we don't know the impact of the vaccines on pregnant women. So we've just tried to make one as clean as possible without any extra chemicals or preservatives or anything else in there. Now, testing for those preservatives in the general population has shown that they're very, very safe.
Right.
I have no hesitation in recommending to people to go get the vaccine. The only reason that you should not have the vaccine is if you have an allergy to any of the components of the vaccine itself. So these vaccines are grown and developed in a liquid that may have egg protein in there. So if you have an egg allergy, it's reasonable to say, hold off, don't get this vaccine. And maybe we could use a different type. Maybe we could use the nasal spray. But again, the nasal spray is in very limited supply, and it's meant for children between the age of 2 and 17. If you've had a flu shot in the past and you've actually had an allergic reaction, and I mean a true allergic reaction, not just soreness at the site of the injection, a true allergic reaction would be getting a swollen mouth and shortness of breath and breaking out in a major rash all over, then it's recommended that you avoid getting the flu shot in subsequent years and just leave it for now. There is further research being done on different types of vaccines, which will then circumvent that and be available for those patients. But we're still waiting for those vaccines to come out.
Is there any issue with mixing with other medications or other conditions, other illnesses or chronic illnesses that for folks in those kind of conditions that they should be thinking about?
The only condition that I would avoid giving somebody a vaccine in would be if you had something called Guillain-Barre Syndrome, and that is where a virus has attacked that person's nervous system. And their system is overall quite sensitive to getting exposure to any virus particles. We have to remember that the majority of these vaccines are containing dead virus particles, right? So we expose our body, our immune system to dead virus particles. Our immune system recognizes those particles, and then in future, what we do is, in the future, our immune systems will then recognize that particle and develop a response to it. There's one vaccine, the nasal spray, that is a live vaccine. So it actually has the potential possibly to create some minor flu-like symptoms. So you may get some nasal congestion, mild flu, and in that situation, we would manage those symptoms. But they're usually limited in how long they may impact a person. So you might have that for 1 or 2 days. Typically what I see in most people, and I've been giving flu shots for the last 25 years, my patients will complain of a slightly sore arm at the site of the injection, and that typically goes away within about 24 hours. The recommendation to patients is that if they get soreness at the site of the injection, please apply some ice. And if it's still uncomfortable and painful, you can use Tylenol to decrease the pain. And occasionally, if you do have a fever associated with the injection, because your immune system is creating that fever, not because you have an infection, but because your immune system is actually geared to try to get rid of that antigen. And fever is one way to get rid of it. You can use Tylenol for the next 1 or 2 days, and it should calm down.
Yeah, sometimes I think there's a bit of a myth around that of people who say, well, I took the flu shot and it was great. It immediately gave me the flu, but that's not really true, is it?
No, because a dead virus particle cannot cause the flu, right? So
Right.
you may have a minor reaction, and that's usually your own immune system gearing up to give you the protection. Once you get the vaccine, your immune system typically takes about 2 weeks for you to actually get the protection as your immune system builds these proteins called antigens. So the vaccine is actually not effective for the first 2 weeks after you get the injection. It takes that long for the immune system to ramp up.
Yeah, and that's really good to know because I think people say when they get vaccines, they feel some level of invulnerability. So I mean, in times of COVID, we need to always be cautious anyway. But it's being particularly careful, remaining careful over the next couple of weeks, particularly with seniors and others. A question going back to that conversation around folks with chronic disease. I guess based on what you said, it would actually be more important for those folks to get the vaccine because they may be more vulnerable to the impact of the flu. Is that right?
So anybody that has a chronic disease that they're dealing with, regardless of what it is, other than that 1 or 2 neurological conditions that I talked about, those patients would be at higher risk of picking up a virus infection simply because their immune system is quite busy dealing with their chronic condition.
Yeah.
We
Yeah,
need
yeah.
giving the vaccine to those patients is actually much more beneficial than say giving a vaccine to a young healthy person.
We've heard how dangerous COVID is. Is the flu this? Can the flu be considered to be in some ways just as dangerous? Maybe not the same death rate, but as dangerous for some parts of the population, those with chronic disease and seniors.
It can be, but they have different impacts on the body. So influenza virus, as I mentioned early in my description, was that influenza virus typically just infects the upper airway and into the lungs. And it can cause pneumonia, which pneumonia can be fatal,
Mhm.
especially if you're elderly and you have multiple other health conditions and you're unable to fight off the virus infection by yourself. COVID, on the other hand, impacts not just the airways, but it also has an inflammatory condition that impacts the blood vessels as well. So we see further organ damage with COVID. And so that's why COVID has a much higher death rate than the influenza virus. Now, typically and I'll use US numbers because it just shows a bit more dramatic how big an impact it can be. In the US, typically every year pre-COVID, we typically would see anywhere from 30 to 60,000 people dying of influenza. In Canada, typically that's been around the 3,000 mark. And that's with us giving vaccines to whoever needs it and to the more vulnerable populations. Some people refuse to get vaccines because of their belief systems. In COVID, if we didn't do all of the social isolation and distancing and mask wearing, the death rates would be much, much higher. And in the US, even with some level of trying to avoid catching COVID, we've already seen that they've had 230,000 deaths. So
Okay.
that's the difference in the magnitude.
And I guess that's, just kind of going to that, particularly for seniors. I keep going back to seniors because obviously that's where the greatest risk around COVID is. There's a risk of if you get the flu, you may need to go to the hospital at some point. And if you go to the hospital, there's an exposure. There's a chance of exposure to COVID just through that process. Is that something folks should worry about?
Um, I don't agree with that. Our hospitals have actually really improved their control systems, and so they're some of the safest places to be. If you need care, please reach out, talk to your family physician, nurse practitioner, and get their advice as to whether or not the symptoms that you are having of a worsening infection, can they be managed at home? If they can't, then if your care provider recommends that you go to the hospital, I would not hesitate to go. right? Because your condition may be worsening, your lungs may be filling up with inflammatory fluid, you may need support with oxygen, antibiotics for the pneumonia that could be connected to the virus infection. And we can't deliver those additional pieces of care that you need at home. And so in the hospital system, you will be protected. You will have a separate room, and all of the staff are well trained to try to minimize your risks. So I would trust our healthcare providers.
Great, thank you. I want to talk a little bit more about the options that folks have, and where they can get the flu vaccine. I know that Dr. Henry's done a really great job of encouraging people to get the vaccine this year, and already we've seen far more people come to get the vaccine than we had in previous years. And also there's been pressure on the health system overall around COVID, so it's added up to some pressures, but we have some options that we can give people. But a question that I have just before we get to that, it kind of ties the two together. Would it be possible, because I know that the one of the options is through the testing site, would it be possible to both get tested for corona and get my flu shot at the same time if I had the right symptoms?
So if you have any symptoms of a respiratory infection that trigger you to go get tested for COVID or coronavirus, it's recommended that you not get a vaccine at that time.
Okay, why is that? Just so I know.
Same thing for if you have any respiratory infection symptoms, your system's already dealing with a infection, and if we give you dead virus particles as an injection, your immune system's going to be taxed even more, and it has to. So your infection symptoms may actually flare up. And earlier you had asked me the question about can the flu shot make you sick, right? So what happens in that 2-week period, people often may have mild symptoms just before coming in to get their flu shot. And when we talk to them, we ask them, do you have any symptoms? No, I'm fine. Because they want the vaccine. They want to protect themselves. And what ends up happening is as their immune system is gearing itself up to produce more antibodies to fight the infection, the underlying infection that was just starting may actually flare up. And that's why people often report, I got the flu shot and I got sick. It wasn't the flu vaccine that makes them sick. It's that initial underlying infection that they typically would have gotten rid of by themselves. We've just allowed the immune system to back off away from dealing with that, and then that flares up. And so it's not recommended to get any vaccine when you're feeling sick.
Okay, that's great. And that's great.
Even minor symptoms, I would hold off. Give it a couple of days, maybe a week, allow things to settle down. When you're feeling perfectly healthy and well, that's the best time for you to go and get your vaccine, any vaccine.
So I just want to go back to, and just before we go to the options, one of the things that 2 weeks ago, I would say 2 or 3 weeks ago, there was a fair amount of angst in our seniors population because they were being told to get these shots. They were being told to be vaccinated, but they were finding that the options that were available to them then were almost non-existent. They were able to make appointments with some of the pharmacies who were delivering vaccines, but those weren't available for weeks away. So they were getting quite worried about that. But 2 to 3 weeks later, they still have that angst, but it's also shifted to, should they really be going out in the COVID environment, the way it's changing, to get a vaccine? It's a hard one to answer, I know, but is there any advice you could give to folks around that as to how they make that decision?
So my advice would be that if you're a senior or you have any other chronic health conditions, even as a young person, you are more vulnerable to an infection, period. Mm-hmm. And it would be highly recommended that you get the vaccination, especially influenza. Get that so you got more protection for yourself. Now, as far as is it safe to go out and get the vaccine? We are, as a healthcare system, we are working in Burnaby to try to get multiple avenues that are safe in order for people to get out there and go. So I would call, if you have a family physician or a nurse practitioner, call them ask them, are they still giving vaccinations to their own patients? That would be your best place to go get the vaccine, because most physician offices are seeing people on a limited basis. And the reason for that is that they are trying to control the number of people coming into the office. And when the patient leaves, there's a lot of sanitization that goes on in between patients. And so I can guarantee that physician offices are clean and it's safe to go there, but in a controlled fashion. So if you had asked me about flu vaccine last year, prior to COVID, we had a mass clinic where we had a long lineup outside our office, down the staircase, and outside the door onto the street. We're not doing that anymore. So we are specifically calling people into our office. We give them a specific time. Please come at this time and be ready. Wear a t-shirt under your jacket. We want you to be there briefly for your injection, and then you can go home. And that will then clear up the space so that the next person can come in.
And it does seem as if all of the options that are available, and actually, Manny, if I can get you to put up the BurnabyFlu.com website, all of the options that are available that we know about are by appointment. I think for specifically from what you're talking about, to ensure that that there's not increased risk, and that there's and that it's sort of orderly, and also makes things easier for both the providers and for the folks who are getting the shots. I do want to the BurnabyFlu.com website, which you see up in front of you now, is a website that has been put together to ensure that everybody has the opportunity to get a vaccination. There are a variety of options that are open, and Manny, you can possibly scroll down, and we're going to do everything we can to continue to.
There's no scroll; it's not live.
Oh, I thought we did have it up.
The website is live. The website.
It is live. Yeah, we have.
It's just a slide.
No, we didn't want the slide. We actually wanted to share the website if that's possible, but we can speak to it for a moment in any event. So the BurnabyFlu.com website will have all of the information as to where, it has all of the clinics that we know about that will be currently making vaccinations available to their patients. It will also have the information on the other options, the testing site and the UPCC, and it will have as well as the options that are being offered by public health from the Fraser Health, and as well as some of the pharmacy options. And it will have you'll be able to book through this site. That will be back next week. You'll be able to check in and book through this site. So, Dr. Sanghera, can you talk a little bit just about you talked a bit about the option of going to see your family doctor, and obviously that's the safest and the safest option. There was a question about the cost. The flu vaccine doesn't have a cost to it if you have a medical health number. Is that right?
Well, it's not just that. You have to be anybody over 65. Anybody that's at higher risk is eligible for a free vaccine. So anybody that's over 65, anybody that lives in a long-term care facility, anybody that's pregnant or has a chronic condition such as heart or lung disease, diabetes, cancer, HIV, rheumatoid arthritis, chronic kidney disease, chronic liver disease, anemia, any child or adolescent between the ages of 6 months to 18 years. They are all included in that group. And then there's also all the people that are at risk of transmitting to those groups. So anybody that lives with those people or comes into contact with them on a regular basis, all healthcare workers, any volunteers or students that may be coming into contact with those people. So you can see that the list is quite long. And I would say that the majority of people are eligible for a free flu vaccine.
So are there examples of folks who wouldn't be eligible for a free vaccine? And if so, what would their cost be, and how would they go about paying, I guess would be the question.
the rare person that lives by themselves is a young, healthy person with absolutely no health conditions whatsoever, and they don't meet up with anybody else. Those would be the people that would not be eligible for a free vaccine, and the cost to them is $20 for the vaccine and whatever injection charge there is. And that varies depending on which provider that they go to, whether it's a family physician or a pharmacist. So I would probably say somewhere in the range of a total cost of $40 to $50 for the vaccine.
Great.
Right.
So
So
can you?
the other question actually you had asked me earlier and I didn't answer was the other options for getting the vaccine at Central Park. It's a drive-through, right? And so that is also a very safe place to go to get vaccine. And you would book the appointment on burnabyflu.com, and you will be given directions as to which location to go to. You would either go to Central Park as a drive-through or as a walk-in patient at the Edmonds Urgent Care Center. And when you show up at Central Park, you basically will be asked to drive into a particular lane, and you will give your information, your identity will be checked, and then you will go up to the nursing station where the injection will be given to you. And it can be provided either while you're sitting in your car, or we can actually have you sit outside in a chair, very comfortable, get the vaccine, get back in your car. You will be asked to wait for about 15 minutes in your car further down the lane. Just for safety, make sure that, because at Central Park, we're giving the shots to anybody that comes through. And we don't know if anybody's going to have any reactions. So some people don't like needles, they may faint, and we don't want them driving away. We want them to actually stay, be comfortable, and once they're comfortable, then they can leave. And we're also trying to make sure that we catch any allergic reactions if they happen. It's rare, but it can happen, so we just want to be extra careful. The urgent care center will also be doing the same procedure, where a patient can book an appointment through burnabyflu.com. They can come on site, they can walk in, and a nurse will assess them, give them the flu vaccine, and then ask them to wait for about 15 minutes before they leave. If you go to see your family doctor who's giving your flu shot every year and they know that you don't have any reactions, you may not have to wait the 15 minutes. That's the only difference.
Right, and I think you mentioned, maybe you didn't mention, but it will be on the site. What are at the Central Park site and at the UPCC? The hours are a little bit different. Is that right?
That's right. So the Central Park site will be providing vaccine Wednesday, Thursday, Friday from 8 till 11. And then at the Urgent Care Center, they are providing vaccine from 12 till 3:30, Wednesday, Thursday, Friday, and then 8 till 3 on the weekends.
And I know this is and we can talk a little bit more about this in terms of the supply. But is the hope that all of the vaccines, i.e., vaccines for children and for pregnant women and for seniors, will be available at those sites most of the time?
Yes. Yeah, as long as we have the supply. And I know the province had ordered, I think in the range of 20% more than they had last year. So expecting that we would have a higher uptake. And because of the COVID pandemic ongoing, there's actually been a greater response than was expected. And the province has ordered more vaccine, and we should be able to keep up with the demand.
Yeah, so you feel confident that there will be, because I know that's been sort of in the absence of information. Those are the rumors that kind of become rampant. Is that if I don't get it now, they'll run out, and I won't be able to get the vaccination this year.
I would still recommend that people try to get their vaccine done, by the end of November, early December, because we want to get that protection into your system as soon as we can. And the vaccine protection lasts for anywhere from 4 to 6 months, depending on how your immune system is. Flu season usually typically peaks around December to March. So we want to cover that period. And I think we should be able to do that. If any particular vaccine is, say it's run out and supply is not there on that particular day, it's safe to get the other vaccines. They still will provide you with good protection. The only one that I would hesitate to interchange would be for women that are pregnant at that time. So they should hold out for the Agriflu, and we do have adequate supply. If not that day, we can reschedule for a different day.
Yeah, I guess I was gonna, I was wondering if when people book, they would know what they were booking for, but then of course that would mean you'd always know what your supply was, and that's a little bit tricky.
Mm-hmm.
Imagine, yeah. But I think that the kind of options that are being provided are convenient enough that folks will be able to get what they need. Is the same thing true on the supply side for family doctors? Is it you'll be booking something? Is there any chance that they will run out of supply?
We have been told that the supply is continually being renewed, and so I have confidence that we should be able to get the supply as required. We may have to wait a few days, but the supply will continue to come through. Yeah, no, I don't have any hesitation saying that. I know that the government is definitely making best efforts at trying to get that supply there.
Great. And I guess I just want to go back to a little bit of a plug for the work that Dr. Sanghera and the team have done at the testing center. The nice thing about it is they've developed such a streamlined and efficient and safe system that you're easily able to translate that into vaccination. And you're using the same kind of safeguards and same kind of processes. Is that right?
Absolutely. Yeah. We try to make sure that our patients feel absolutely safe, and also our staff are safe as well, because if the staff are not safe, then they'll be able to pass on the infection to somebody else. We don't want that. We want everybody in our community to be as safe as possible, and so we're striving to keep that there.
And
there's a couple of questions.
There are a couple of questions
that came up in the chat that I wanted to address. One of them was, for which symptoms should one hold off on getting the flu shot? And it's any respiratory infection symptoms, so cough, cold, congestion, sore throat, mild fever, hold off on getting the flu shot. And the flu shot does not provide you with any protection against an underlying infection that you have. In fact, while the immune system is ramping up to build the antibodies to protect you, it will aggravate the infection that you have. So and this is one of those myths that we need to make sure that people understand, because often those are the people that will say, I got the flu shot and I got sick, because they were, in their understanding, they may, if I'm getting a little bit sick, I'm going to go get the vaccine, I'm going to get protected right away. That's not the case.
Right. Yeah, it's not going to help.
So please don't get the flu shot if you have any respiratory infection symptoms.
But do get tested.
You can, yes, absolutely. Go there and get tested for sure. And then testing starts at 11:30.
Great. There is a question around, and I'm not sure if you know this, around eligibility for free vaccine for immigrants or newcomers. Do you know if that's a possibility?
So if you have a PHN number, an MSP coverage is there, and you fit the criteria for a free flu shot, then yes, you can have a free flu shot. If you don't have an MSP number or PHN number, then you would have to pay for the private one.
Okay. And I guess I'll ask if there are any more questions out there. I think we've done a pretty good job of answering questions. I think that, in fact, there's one that came up that was just about how long does the flu shot take to start working. I think you answered that. So you said a couple of weeks. Is that right?
2 weeks.
Yeah. Yeah, but I do want to, I'm just kind of going back to the testing center. I think what we're all hoping is that this is a great rehearsal for the next vaccination process that's going to come soon.
Which we should be expecting next year at some point.
Yeah, you'll have it down pat if you don't already. Mm-hmm. So I don't see any other questions. If you have some, please, as we talk, you can. Dr. Sanghera, do you have any final thoughts just before we leave folks today?
I do see one more question that's come up. And are there any side effects of flu shots relative to medication? So the flu shots do not interact with other medications that somebody is taking. Yeah. And the majority of reactions that I may see in situations, wherever you get the needle injected at that site, you might feel discomfort, so we can deal with that. There may be a localized reaction, which would get better with applying ice to that area. And as I mentioned before, you might get a mild fever for the next 24 hours, and that can be dealt with some Tylenol.
Perfect. Thank you.
Last thoughts you would ask me, I would highly, highly recommend to everybody this season, absolutely, please go out and get your flu shots, get some protection in about 2 weeks' time, and don't hesitate to do so. The risk of reactions or side effects is very, very rare. I've been giving shots out to my patients for the last 25 years, and touch wood, I haven't had any major reactions that we haven't been able to deal with. I personally have been getting flu shots every year since I've entered medical school. And so in the last 30 years, I haven't had a day off work for being sick.
Great. That's
other
great.
reasons, yes, but not for getting the flu. And so it's important to get that protection and feel safe that you're doing the right thing. There is a lot of misinformation on the internet. Please avoid getting stuck with that misinformation. If you have questions, feel free to call your family physician or a nurse practitioner and get the questions clarified. We're all open to answering any questions that you have.
Excellent. Thank you. I do want to, Manny, if you could put up the last slide for me, it would be great. It just kind of gives some of the resources that we had. I do want to again thank Dr. Sanghera. This has been tremendously valuable. For me, I certainly learned a lot, and I hope you did as well. These are the sites that you should be aware of. The BurnabyFlu.com website really does cover off all of where you can get the vaccines in Burnaby. It'll give you an opportunity to book online for some of the sites that we've talked about, in particular for the testing site and the UPCC. There's also a link here so that you can, if you need a family doctor, to link there. If you go to the Fraser Health site, I know we have a little bit of information about the clinics they're offering, but they're changing all the time, so you can keep up to date on the public health clinics that they're offering as well. And then the BC CDC site gives a more in-depth information on the disease itself. This is a presentation of the Burnaby Primary Care Networks and its community supports. That BurnabyCoronavirus.com website has an awful lot of information. You can find out about testing, but also about all of the supports that are available for folks in our community around COVID. And those are supports that include all of the medical supports, but also all of the community supports around food and mental health and supporting seniors and our most vulnerable populations. This recording will be available on that site, the BurnabyCoronavirus.com site. So if someone was asking if they could see it again, that's a place you can see it again. And also, as a participant in this session, it will be emailed out to you that will include this slide deck, which shows you the links and how to get some more of that information. So I just want to echo Dr. Sanghera's last comments. You should feel safe as you go out to get a vaccine, and you should be encouraged to do so for your own sake, and also for the sake of your family, and just like the COVID, you may be able to survive it well, but others in your family would be much more direly affected. So I think it's always, those were great words of encouragement. So thank you again, and again, thank Dr. Sanghera. It was great to have him here. It was great information. We'll let you go on a Friday afternoon. Enjoy the sunshine, because you never know how long it will last. Thanks much.